Good day, everyone. Welcome to another episode of the Circle Direct podcast, the podcast that seeks to break down complex medical topics for easy to understand discussions. I'm your host, Dr. Tiwa, and today we're going to break down a very vital medical condition today, which is called hydronephrosis. We're going to speak as to how it affects children and how it affects adults and what complications may come around. What do you need to see? What symptoms do you need to look out for? What investigations need to be done? And what causes these conditions specifically? We hope you'll get to learn everything that has to do with hydronephrosis with this episode. Stay tuned. What is hydronephrosis? Literally, in hydronephrosis, it is called water in kidneys. So hydronephrosis, that's water in the kidneys. But hydronephrosis actually is the swelling of one or both kidneys due to buildup of urine. So normally, urine flows from the kidney downwards through the urethras down to the bladder. However, if there is anything that alters that transition from the kidneys through the urethras down to the bladder, or any problem with the urinary system, the urine backs up. And once urine backs up, the kidneys begin to swell. The term itself, like I had stated before, it's a Greek word, hydro, meaning water, and nephro for kidneys. So it is water in the kidney. That is what it is when we're speaking about hydronephrosis. So now, hydronephrosis isn't a disease in itself, but it states for an underlying issue, especially when it comes to disruption in flow of urine. It can range from mild to severe depending on how much the kidney is swollen. Moving on, we're going to speak about what are the causes of hydronephrosis. What can cause for urine to build up, or what can cause for the urine to go back up? There are several factors that can actually lead to hydronephrosis. First off, in adults, what are the most common causes? First off, we have kidney stones. So kidney stones are small hard deposits that can block the urine flow in the ureter. Secondly, we have prostate enlargement. Now, in prostate enlargement, the prostate expands, pressing on the ureter. And if the prostate presses on the ureter, it's a condition called benign prostatic hyperplasia, making it hard for the urine to exit the bladder. Thirdly, we have pregnancy. The growing uterus can press on the ureters, impeding the flow of urine, especially in the latter stages, the third trimester of pregnancy. Fourthly, we have things like tumours, cancers of the urinary tract, which can be impediments for the flow of urine. Scarring or injury, for example, previous surgeries or infections, can leave scars that obstruct the urine flow when it comes to hydronephrosis. Now, for children, the most common causes for children, first of all, is congenital abnormalities. Some babies can be born with structural issues in the urinary tract which prevent the urine from draining properly. Case and example is vesicoureteral reflux. In this condition, the urine flows backwards from the bladder into the urethra and kidneys, leading to hydronephrosis. We also have a male-specific condition called posterior urethral valves, in which there is a blockage in the ureter that can occur in male infants that prevents urine from flowing normally. So the symptoms of hydronephrosis usually vary depending on the severity of the condition for the particular person that is suffering it. So it can develop suddenly or gradually, and people may not notice these symptoms, especially if it's, for instance, a mild condition. But if the kidney is affected, especially when it comes to an obstruction, commonly individuals can experience things like flank pain or tenderness, difficulty or pain when urinating, frequent urge to urinate, blood in the urine, which is called hematuria, nausea and vomiting, urinary tract infections. Now, the mode of these symptoms coming about when it comes to blockage of the ureter, we'll discuss as we move on. Now, for babies or children that their condition is usually tied to congenital abnormalities, symptoms may not be apparent, but then they can be discovered incidentally. So when we say it's an incidental finding, we mean we do not go in to check the baby because we think the baby has hydronephrosis. We're just doing a typical prenatal ultrasound. And when the prenatal ultrasound is done, we can now incidentally find that this baby or this child has hydronephrosis. So when diagnosing hydronephrosis, a doctor typically starts with a physical examination. So if the patient presents with pain in the flank pain, for instance, we have what we call a right costal tenderness, where the doctor hits the back on the left and the right side to elicit pain on the patient. Now, if the patient feels a sharp pain when he's being physically examined, then we can now say, okay, there might be an underlying condition that hydronephrosis can be taken about. But physical examination is not the definitive diagnostic criteria for hydronephrosis. We do other investigations, for example, urinalysis, to see if there's any blood or any infection in the urine, and also ultrasound imaging to visualize the kidneys and the degree of swelling if hydronephrosis is present. Now, a CT scan or an MRI can also be done for detailed imaging, especially if the cause of the hydronephrosis is not immediately clear. Moving on to the treatment modules. Now, for treatment of hydronephrosis itself is not a diseased condition that occurs on its own. There is an underlying cause. So the treatment of hydronephrosis is to treat the underlying cause. Now, in mild cases and when the issue is temporary, there might be no need for treatment, just to monitor the condition as required. But if there is any severe obstructions, there are different treatment modules that can be followed. First of all, drainage. There's something called a nephrostomy, where the tube is inserted to drain urine directly from the kidney. So speaking of drainage, if there's an immediate need to relieve pressure on the kidney, a nephrostomy tube can be inserted to drain urine directly from the kidney. Secondly, a surgical intervention may be required to remove the impediment that is causing the urine backflow. It is typically a stone or tumors, or even if you want to correct structural abnormalities. Another treatment module that can be used is a stent placement. Now, a stent will be placed in the ureter to keep it open and expand the ureter for urine to pass through freely. Fourthly, medication. If the cause of the hydronephrosis is an infection, then antibiotics will be prescribed. For conditions such as benign prostatic hyperplasia, medications can help reduce the prostate size and alleviate the pressure on the urethra. Now, it is crucial, very important, to address hydronephrosis early, because prolonged swelling will cause permanent kidney function damage. That is where we now move on to prognosis and complications that can come about if timely treatment of hydronephrosis isn't done. Now, the prognosis for hydronephrosis typically is generally good, because as long as the underlying cause is corrected, the kidney function will return to normal. However, if it is left untreated, hydronephrosis can lead to complications. What are these complications? Number one, kidney damage. Now, the longer an obstruction lasts, the higher the risk of permanent kidney damage. When we say permanent kidney damage, we're looking towards things like chronic kidney disease. Now, infections is also another complication that can arise, because when a stone is impeding the flow of urine, that position is a site for infection and increases the risk of urinary tract infection, which can spread and lead to severe infections like sepsis. And when it gets to sepsis, sepsis is known to be a terrible prognosis. So deal with a condition as early as possible so that the progression does not get to that point. So when it comes to prevention and monitoring, while you can't always prevent hydronephrosis, especially in cases of congenital anomalies or tumors, there are some ways that you can lower your risk of getting hydronephrosis. First off, you have to stay hydrated. This helps flush out the kidney stones, which, if they are very tiny, of course, and prevents them from forming. Also, monitor your urinary health. If you notice any changes in your urination, such as maybe difficulty in urinating, pain, or increased urinating at night, for instance, you have to check how you urinate. Is it dribbling? Do you urinate more now? Do you urinate less now? Those kind of things help to check your urinary health. Also, regular checkups. For individuals with history of kidney stones, benign prostatic hyperplasia, or any other risk factors, regular monitoring can help catch any potential issues early, especially because your kidneys are very vital for your body. Your kidneys help purify, in quotes, your blood from harmful substances. And if your kidneys are affected from effectively moving out waste product out of your blood, so you have to go to your healthcare provider to make sure that you have regular medical checkups. You can do a full body checkup at least 2 to 4 times a year, if that is as comfortable as you can get in terms of checking yourself personally. And for parents, if a baby is diagnosed with hydronephrosis in utero, early consultations with a pediatric nephrologist can help guide treatment after birth. So in conclusion, when it comes to hydronephrosis, early detection and proper treatment is key in preventing complications, especially if you or a loved one experiences any symptoms that have been stated here, or you know anyone that has risk factors, related to this condition. Be sure to consult a healthcare professional and also to look through what we spoke about when it comes to prevention and monitoring, which is stay hydrated, make sure you do your regular health checkups, and to monitor your urinary health. Always be proactive with your health care and notice every single thing that has changed about your body, because that making that decision might be the difference between managing a condition effectively or having to deal with the complications that come with it. Thanks for tuning to another episode of Seco Direct. Don't forget to subscribe and leave a review if you found today's episode helpful. If you have any comments that you want us to get to, please leave them in the comment section below. And always know that you have to stay proactive with your health, and we'll see you in the next episode.